As a coach, team manager, or athletic trainer, you know it's important for your athletes to keep their muscles and bones healthy. It's also important for athletes to take care of their skin. Otherwise, athletes could get a skin infection that may take them and their teammates out of the game for days, weeks, or months. Athletes are at an increased risk of skin infections. They can easily pass bacteria, viruses, and fungi that cause infections to each other through skin-to-skin contact that occurs during training and competition. Sports equipment, especially protective helmets and pads, creates a warm, moist, and dark environment that encourages germs that cause infections to grow. Skin infections can have serious consequences. When an infection occurs with a fever or chills, medical attention is needed. Infections can affect one athlete and may spread to other teammates. Follow these tips from dermatologists to prevent skin infections in athletes. Make sure athletes keep cuts and scrapes clean and covered with a bandage until healed. A cut or scrape weakens the skin's defense and allows germs that cause infections to enter. You can also reduce infections by preventing blisters. Be sure your athletes apply a pad, gel, or spray that protects the skin to areas that routinely blister. More specialized socks and gloves can prevent blisters on the feet, ankles, and hands. To prevent blisters on the feet, make sure your athlete's footwear properly fits. Wearing 2 pairs of socks can also help. Athletes should wear moisture-wicking clothes to keep the skin dry. This prevents germs from growing. When clothes wick moisture from the skin, you'll see this stated on the label. In the locker room, make sure athletes wear sandals or other shoes to reduce infections on their feet. Athletes should shower after every practice and game. They should use an antimicrobial soap and make sure they wash their entire body. Athletes should use a clean towel after each shower and always use their own towel, soap, razors, and other personal care items. They should not share these items with others. Ask your athletes to wash their clothes and towels after each use. Be sure they wash their sports bag too, as germs that cause infections can remain in the bag and grow. Disinfect equipment, including protective gear, daily. Follow the manufacturer's instructions for disinfection. Check your athlete's skin regularly, especially in high-risk sports, such as wrestling. Look for any changes, such as cuts, sores, redness, swelling, and pus. Report any changes to an athletic trainer or doctor. Ask your athletes to check their skin daily. Make sure athletes don't use sandpaper or other household items such as bleach to pass a skin check. This will cause more damage to the skin and keep them on the bench longer.
If you or your athletes notice anything on their skin that itches, burns, or is infected, they should see a board-certified dermatologist or sports medicine doctor. Without treatment, skin infections can worsen. A dermatologist can prescribe effective treatments to help your athletes get back in the game.
To find a dermatologist in your area, visit aad.org.